Hello, myself Dr. Sachin Honguntikar. I am head of clinical genetics department in Anderson Diagnostics and Labs, Chennai. When I think of mother and child care, previously there were only few technologies like everybody were dependent on the conventional cytogenetics method, maybe a peripheral blood karyotyping, amniotic fluid karyotyping, or the fish. But over the period of the time, the microarray and NGS has revolutionized the genetic testing platforms. It has yielded better diagnostic efficiency compared to that of the conventional cytogenetics methods. I have a few interesting cases on the clinical scenario where the fish or karyotyping came out to be a normal, whereas the microarray has picked up those kind of a variant and helped in the right clinical decision making. When we talk about the NGS technology also, before NGS there were so many disorders, so many Mendelian disorders, thalassaemic disorders were missed. But due to the advancement in the NGS technology, the science has progressed, the diagnostic efficiency in the clinical setup has remarkably progressed so that we will get a better clinical outcome. Definitely, there has been significant improvement in the diagnostic efficiency and the clinical outcomes using this technology. In my mind, I remember a case still now. We were about to miss a 21st chromosome Down syndrome, where the karyotyping and the fish showed the normal, but luckily, due to the advancement of the technology of qPCR and as well as the microarray, which was covering that particular region, and we were able to pick it up and we were able to give the doctor the right answer. See, these technologies played an important role. Many people are aware of these kind of technologies because our laboratories are present on the metropolitan cities. So most of the metropolitan cities doctors and aware clinicians are aware of these all technologies. But the major challenge what I feel is the reach towards the tier 2 and the tier 3 cities, where they don't even have a awareness, and there is not even education system what to be done for it. And we are doing lot of camps, CME activities with the local doctors, with the local population, what all screening tests they need to undergo when there is a pregnancy is established. So this helps in the better clinical outcome, better in reduction in the mortality rate, which is a very important or a significant point to be addressed by anybody, either it is from a government or it is from an individual. See, when we are talking reproductive genetics healthcare, one of the major reason of our country is the consanguineous couple. So it becomes very important. And when I told about the microarray, a microarray has to be one for all solutions for the prenatal cases, replacing the amniotic fluid karyotyping in my opinion.